Hi everyone, thank you for coming today. My name is Colleen Morta. I'm a graduate student at Drexel University in their Nursing Education and Faculty program. I just want to say thank you to Kim and the ladies from Berlinta for kind of bringing this all together for me. Just as a little background information for me, I graduated from Holy Family University in 2011 with my BSN. Started working in a small little hospital, St. Joe's in North Philadelphia, in their emergency department, and then started working at St. Joe's in Reading in 2012. So most of my experience is emergency nursing, so if there are a few references regarding to that, just because that's what my knowledge base is. Okay, so for our learning objectives today, we're going to define the appropriate drug class and usage for nitroglycerin, define the contraindications and adverse effects in administering nitroglycerin, explain the clinical pharmacology of nitroglycerin, identify the process of titrating nitroglycerin in regards to patients' clinical status, identify the appropriate use of nitroglycerin in a patient case scenario, and perform successful titration of nitroglycerin on the Alaris pump. So we're just going to review some of the basic information about nitro. Nitroglycerin is considered an organic nitrate. They work by relaxing the smooth vascular muscle, also by dilating the coronary veins. It then decreases the preload as well as how hard the heart is working. And just as like a A&P type of review. An organic nitrate works by the intracellular conversion to nitrate ions, which then result in nitric oxide. This then activates the guanylate cyclase and increases the cell cGMP. The elevation of this ultimately results in relaxation of the vascular muscle due to dephosphorylating of the myosin light chain. So that was a lot to say. Okay, so some of the uses of nitroglycerin. There were so many, so I just put a few of the key ones that I've seen it used for. Angina, acute congestive heart failure, pulmonary edema, acute myocardial infarction, acute pulmonary hypertension, and hypertensive urgency. Cardiac conditions such as these place a great amount of force and pressure on the heart and forces the heart to increase the workload in order to properly perfuse the body. As previously mentioned, the nitroglycerin acts as a vasodilator to kind of decrease that vascular resistance and decrease that force on the heart. So there's many different ways that we can give nitro. Orally, obviously, the sublingual tablets, topically with our nitro paste, intravenously, and rectally. In emergent situations such as dealing with acute onset of cardiac disease, the most frequently used routes of administration are the orally and intravenously. But for today's session, we're just going to focus mainly on the intravenous route and titration of the nitroglycerin drips. So there are some contraindications to giving nitro. Obviously any allergy to nitro or to corn products, pericardial tamponade, restrictive cardiomyopathy, and patients who take phosphodiesterase 5 inhibitors such as evanafil, sildenafil, tadalafil, or vardenafil. Prior to giving any type of medication, it's important to assess for any type of allergy. It's also, for this particular drug, it's important to ask male patients if they take any type of male enhancements, whether it's Viagra, Cialis. As we all know, the use of these medications with nitro can result in severe hypotension or even fatal. It can be beneficial to ask patients about this in private if possible, just because they're more willing to disclose this information when they're not around their friends or family. And we have a great example of this, one of my favorite movies actually.
Great movie.
once we skip the ad.
Watching college football through confetti. Missing out is not an option, so plan accordingly.
Cardiac arrest. Check 120. What's the theater? 95. 31 right here. How we doing? Doc, you said 30 minutes of chest pains, nausea, shortness of breath, pulse 104, respirations 18.
Let's get the CVC, CMP, cardiac ambulance, 1280 kg. Mr. Sanborn, I'm Dr. Mercer. Are you in any pain right now?
I feel some pressure in my chest. It's real tight.
Show me where the pain is.
Right here.
What were you doing when the pain started?
I was kissing a beautiful woman.
Having intercourse?
Fortunately not.
Sense of humor intact?
Yeah.
Give me an aspirin with total 5 milligrams and hang a nitroglycerin. Mr. Sanborn, the EKG shows you have a blocked artery which is not allowing enough oxygen to get to the heart muscle.
I'm having a heart attack.
We're gonna stop it, but I need to know what medications you take.
I take Lipitor.
Anything else?
For blood pressure.
What about Viagra? Mr. Sanborn, did you take any Viagra today? Mr. Sanborn?
No. No Viagra.
Okay, good. Just need to be sure because I put nitroglycerin into your drip. And if you had taken Viagra, the combination could be fatal.
So that just explains. Okay, so that's a perfect example how it's important for them to ask those questions before they give the medication and to ask it, if possible, in private. Okay, so some adverse effects from having nitroglycerin. The most common that I've seen with patients, even the pills or the paste, is headache, which physicians normally just treat with Tylenol. Some postural hypotension, facial flushing, tachycardia, palpitations, peripheral edema. There are many more than this. I just kind of put some of the main ones there. It's important for patients receiving nitroglycerin therapy to be closely monitored on cardiac monitoring, also to have staff with the patient, whether they're getting up, moving, just because they can have a sudden drop in blood pressure with that. Okay, so now we're kind of getting into the intravenous administration. So there's a few preparations that it can come in. We've all seen nitroglycerin. It comes in the glass bottles, has a little, well, you can use regular tubing. You just need to open the valve, the white plastic valve that's on the side. It comes in 200 micrograms per ml, diluted in 250 mLs of 5% dextrose, and then the 400 micrograms per ml in the 250 of 5% dextrose. You'll also need an intravenous pump with a profile capable of programming a micrograms per minute intravenous drip. And like I said about the white valve, just so you're able to prime the tubing. And the order from the physician will always come in micrograms per minute, and that'll be able to be put into your pump. The usual adult dosing is 5 micrograms per minute. The rate can be increased by 5 mics per minute every 3 to 5 minutes up to the rate of 20 mics per minute. If still no response at the 20 mics per minute, the rate can be increased 10 to 20 mics per minute every 3 to 5 minutes with a maximum dosage of 400 micrograms per minute, which is a little different for you guys on the floor, because I had talked to Kim and we had said about this dose that it's a maximum of 50 micrograms per minute, or they would need a higher level of care. Obviously, frequent vital signs for these patients, for a patient on nitroglycerin drip, as well as the close cardiac monitoring. From my experience, they normally, being in the emergency room, it's more of them just going into the room, seeing the patient, seeing that their status really isn't getting any better. Oh, why don't you bump him up to 15 mics or 20 mics? Obviously, that have set parameters written for you guys. Okay, so we're going to get into my little patient case scenario here. And we're going to meet Mrs. Jones. She's a 50-year-old female who presents to the emergency department with an acute onset of shortness of breath, peripheral edema, and chest pain. Blood pressure 230/120, heart rate of 120, respirations 26, temperature 36.5, pulse oximetry 92% on room air. Has a past medical history of diabetes, high blood pressure, and congestive heart failure, and allergies to penicillin. When looking at this patient, what would be your first thought of what brings them to the emergency room? Any other ideas? Yes. And what type of orders do you think they would get from the physician? Like I said, this is a little bit more of a ER standpoint, but just a guess. What do you think that they would order?
Maybe nitro?
EKG, lab work, chest x-ray, IV lab work, oxygen, since she is below 95%, about 2 to 4. You want to keep it above 95%. So Mrs. Jones has all that stuff done, and these are some of her results. So she's having increased vascular congestion, which does indicate the congestive heart failure. Lab work, BTMP of 4,000 and troponin of 0.105. So what physician orders would you kind of anticipate? Lasix, cardio consult, nitroglycerin drip, Foley insertion because you want to measure that INO, and admission to you guys. So that's where that would come in. Okay, so they're ordered Lasix 80 milligrams, Foley's in. After the Lasix, the patient has an output of 400 mLs. She's also ordered a nitroglycerin drip at 10 mics per minute. The blood pressure 220/120, heart rate of 120. The patient's respiratory rate is 26 a minute. She still appears in moderate respiratory distress despite oxygen administration. So as the nurse, what would you do next?
Call the doctor. Nitro would be increased.
Yes. From an emergency standpoint, like I said, if the physician had seen this, they would probably just verbally tell you to increase the drip. But from a floor standpoint, if there would be parameters written, we could just titrate that up. And obviously probably call the physician anyway and just make them aware that they're still of what the patient looks like. So we do make a call to the physician. They come to the bedside and assess the patient's status. They want the nitro drip to be increased to 20 mics a minute, and they also write for the standing order to maintain their pressure systolically less than 200 and diastolically less than 90. So we increase that drip to 20 mics a minute. And what are some things we want to monitor during that time after we increase the drip?
It's been effective.
So patient's respiratory status, the heart rate, the blood pressure, and the level of consciousness too, so from the fatigue of not being able to breathe, that they're not decompensating in that way. All right, so she's now resting more comfortably in bed. Her heart rate is 95. She's normal sinus, blood pressure nicely came down at 170/95. Respiratory rate of 20 and pulse oximetry level of 97% on 2 liters of oxygen. And we still have the drip going at 20 mics a minute. Would we keep the drip at this rate, or would we want to decrease it since she's doing better?
Keep it.
Keep it. Yes, we want to keep it at that rate.
For how long?
Well, we could, when either, if the physician comes on the floor, just make them aware of the patient, how they're feeling, that this rate is working for them. They could obviously write the order to just keep it at 20 or if they feel that they can be weaned down, they would write that order as well. Okay, so now we're going to go over to the pump. Reading Health System obviously uses the Alaris pump. It has the drug library on there for the concentration of nitroglycerin. It's always important to use the drug library. I know a lot of nurses in the emergency room, sometimes they just quick go to that basic infusion because they know in their head what it's supposed to be, but it's always safe just to use the drug library, especially with nitro because you get the micrograms per minute and it gives you the right mLs per hour. So just going to quick turn this on and go over it, even though I know you ladies use this all the time, I'm sure.
Show me.
So we're turning on our pump here. Okay, so it's our new patient. Med-surg telemetry would be our profile. And then our patient ID entry. So we're going to select our channel, guardrail drugs. And then under nitroglycerin, we have 50 milligrams per 250 mLs or 100 milligrams at 250 mLs. So for this, we'll just click the 50 per 250 and yes. So it gives you that advisory that it has to be monitored by a specially trained RN and telemetry monitoring is required. So it gives us the time units, the dosing, which is micrograms per minute. So we'd hit next. Our volume to be infused is 250, and the doctor in this case say they wrote for 15 mics per minute. So we'd have a rate of 4.5 mLs per hour, and we would just hit start, and obviously just checking all our patient identifiers and the order as well before we'd start. And changing, oh, okay. And if we would want to titrate, normally you would just select your channel and your rate and then just change the micrograms per minute. Oops. Does anyone have any questions for me?
I do. I have one question.
Okay.
So, we gotta go back to like probably the third slide.
Okay.
So usage of nitroglycerin.
Mm-hmm.
So it's for angina, acute congestive heart failure, pulmonary edema, acute MI, and acute pulmonary hypotension. I don't understand that part. So if you have pulmonary hypotension, it's
Well, nitroglycerin acts as a vasodilator, so it opens up all the coronary arteries. With pulmonary hypertension,
it says hypotension.
oh, sorry, hypertension is what I meant.
Okay.
I'm sorry. That's a typo. I apologize.
Okay, fine. Okay, then that makes sense. Okay.
Sorry about that. Okay, so we can look to the quiz that we had in the beginning here. Oh, thank you. And just kind of go over that. So for number 1, which lab report for a client with congestive heart failure requires nursing action?
B.
Right, so your BTMP of 4,000. Okay, so for 2, a patient with congestive heart failure is receiving nitroglycerin therapy. What reported medication would contraindicate the use of this drug? Yes, so that's your Viagra or your Cialis. The nurse should expect to observe which type of symptom in a client who is receiving nitroglycerin therapy.
Well, D, it's obvious, but I have all of them.
Technically, yes. You can see a lot of these. The most frequently seen side effect would be the headache. So that
But like from my point of view, it's safety first. So hypertension.
Yes, that's true. That's very true. For number 4, so the nurse starts a nitroglycerin drip for patient with congestive heart failure. The drip is started at 5 mics per minute. The patient's having increased shortness of breath and their blood pressure is 230/110. The physician had written a standing order to titrate the medication to maintain a systolic blood pressure of 170 and a diastolic blood pressure of 90. What would be the next action the nurse would do?
8.
Okay. Yes. And for 5, a patient presents to the emergency department with shortness of breath, peripheral edema, and high blood pressure. What clinical diagnosis would you expect for this patient?
D.
Yes.
I had EMD and then I erased. I had CMD and then I erased.
Yes. So the pump's up here if you want to kind of come up and play, but that is my presentation. Thank you, ladies, so much for listening to me.
So much.